Okay, good evening, good afternoon, and good morning. Thank you, all of you, for joining us for today's discussion from really around the world. My name is Rania Saadewi, and I am the Executive Director at the Pearl Initiative. And it is our honor to be hosting today's webinar session, our last webinar session as part of our special virtual Majlis series, held in collaboration with the Philanthropy Network and with the generous support of the Bill and Melinda Gates Foundation. I see here that we have actually a number of new participants to our webinar series. So I'd like to start by first introducing the Pearl Initiative. The Pearl Initiative is the Gulf region's leading independent nonprofit organization working to improve corporate accountability and transparency across the private sector, family firms, small businesses, and philanthropic nonprofit organizations in the Gulf region. We were established 10 years ago by regional business leaders and the United Nations Office for Partnerships. More recently, we are one of the few organizations in the Gulf region to receive special consultative status from the United Nations Economic and Social Council. As part of our governance and philanthropy program, and in response to the pandemic last year, we launched a special virtual Majlis series with the Gates Foundation. This has been a series of learning, discovery, and community building opportunities designed to improve the quality of strategic philanthropy in the Gulf region. Through curated webinars like today's and virtual workshops featuring international and regional experts, we have engaged with over 200 participants, including many of you joining us today, who have been consistently engaged with the program over the last 6 months as you look to strengthen your role as a philanthropic donor and develop a network of like-minded philanthropists and professionals, as well as to have access to different resources to inform and support your philanthropic giving. Today's webinar is our last webinar in this series, followed by a number of virtual closed workshops, of which, if you are interested in, we encourage you to reach out to us. But now, leading into today's webinar session. If you feel that your newsfeed highlights catastrophic events more so now than it ever did years ago, you are not alone. The COVID-19 pandemic aside, disasters, or at least the documentation thereof, have doubled in the last 50 years. Whether this is due to more robust media, or the rise of social media, or the tangible results of extreme weather and climate change, more frequent armed conflicts, or otherwise, the fact remains that humans today are increasingly more aware of acute, large-scale catastrophes. However, studies have shown in response, disaster-related philanthropy constitutes just 10% of philanthropic spending, small when compared to other areas like education, livelihoods, and health. However, given increases in the severity and frequency of reported crises, the median dollar value of disaster-related giving has grown by 69% between 2016 and 2018, more so than any other philanthropic giving category. This number will undoubtedly rise once all of the COVID-19 related gifts are accounted for. But when we look deeper into those numbers, we find that 50% of all disaster philanthropy occurs during the first 4 weeks of a crisis. By the 2-month mark, 70% of that funding has been executed. 6 months later, giving has either largely ceased and the situation often forgotten due to short news cycles and the changes in priorities for the majority of the donor community. While governments are obligated to and busy with first response activities, preparation and prevention measures are natural areas for philanthropy to provide support to meet the full life cycle of a disaster response. And that is what we look to explore in today's webinar discussion. Allow me to introduce our eminent speakers and moderators for today's session. First, we have Tom Khalil, the Chief Innovation Officer of Schmidt Features. In this role, Tom leads initiatives to harness technology for societal changes, improve science policy, and identify and pursue 21st century moonshot ideas. Prior to Schmidt Futures, Tom served in the White House for 2 presidents, including President Obama and President Clinton, helping to design and launch national science and technology initiatives. Tom has also served as a special assistant to the Chancellor for Science and Technology at University of California, Berkeley, and has served as the chair of the Global Health Working Group for the Clinton Global Initiative. Joining Tom on the panel will also be Mr. John Fairhurst, the head of private sector engagement at the Global Fund. Prior to joining the Global Fund, John was an executive director at UBS Optimus, where he worked to increase impact investment funding. Before this, he also served as the COO at the Global Alliance for Improved Nutrition and has helped establish and manage the program portfolio for the Children's Investment Fund. He has also worked in Oxfam, overseeing development and humanitarian programs in East and Central Africa, covering everywhere from the Democratic Republic of Congo to Eritrea, as well as serving as the country director in Afghanistan and working in northern Sri Lanka. Our third speaker is Greg Sixt, who is leading a research initiative of the Abdul Latif Jameel Water and Food Systems Lab at MIT. Greg is leading a collaborative team of researchers on a study on the future of climate and food systems. This team is made up of researchers from MIT, partner universities, and organizations to develop a research agenda to identify and support policy and technology solutions at the nexus of climate change adaptation, food and water. This center is an excellent example of the impact philanthropy can have, in this case supported by the MENA's region's own community Jameel in preparing for global challenges. And last but not least, our expert moderator is Ms. Alex Amiel, who is the Executive Director of SOLVE, an initiative of the Massachusetts Institute of Technology, where Alex also served as Director of Programs. Alex has worked for Save the Children in London and across Asia, the Middle East, and Haiti, and as a management consultant at the Boston Consulting Group. Before I hand it over to Alex, who will lead our conversation today, we do like to make our webinars as interactive as possible, so I encourage you, the audience, to ask questions using the Q&A function on the panel, and the panelists will try to answer as many as they can during the dedicated Q&A session. And with that, over to you, Alex.
Thank you so much. Hi, everyone. I'm Alex Amiel, the Executive Director of MIT Solve, and our mission is to drive innovation to solve world challenges. So thank you to the Pearl Initiative and the Philanthropy Network for convening the session, and to everyone in the audience for joining today. I'm really excited about this conversation. And we are joined by three wonderful speakers who are working really hard to ensure the global community against the ramifications of disasters. So crises, particularly natural and humanitarian disasters, repeat themselves in some form year after year across the globe. And whether or not there's more of them every year or not is a point of contention and research. But despite that, despite seeing these disasters year over year, and I have the statistic for corporate philanthropy, but it's quite useful, less than 2% of corporate philanthropic spending is dedicated to forward-looking activities, including disaster preparedness, risk mitigation, and prevention measures. And that's a problem because we know that it would cost less to invest in prevention and preparedness. So today we'll discuss what philanthropy is currently doing and what more it could do to help the global community prepare for and ideally avoid altogether some of these crises. So let's turn to our panelists, starting, if you please, with Tom Khalil. And so Tom, as the pandemic unfolded, your organization, Schmidt Futures, quickly redeployed its staff and resources towards grant making to help mitigate and solve the current crisis. And now you're shifting your effort more towards preparedness. And you recently held the Forum on Preparedness. So why don't you start us off? Help us understand what the team at Schmidt Futures is doing in terms of preparation and prevention, and what more you hope to do.
Sure, it's a great question. And I'll say a little bit about some of the things that we did at the height of the pandemic, working with other philanthropists and foundations. So we got involved in a project called Fast Grants, which was led by Patrick Collison. And it was really motivated by grant making and funding for research and development during World War II, when the government was making decisions in days rather than months about whether or not to support a given research project. And philanthropists were in touch with researchers at leading universities and discovered that they had lots of ideas to immediately address the pandemic, but the government was not making decision-making on the relevant timescales. So I think that's an example of something that philanthropists were in a unique position to do and made a really important contribution in terms of coming up with new ideas for therapies, for diagnostics, and for vaccines. The Futures Forum on Pandemics, which you mentioned, has led to a couple of working groups, and I wanted to identify one in particular, which is that there's a huge amount that we should learn from this. So it would be a real tragedy if not only do we have this incredible loss of life and economic losses that are estimated to be as high as $25 trillion, but we don't do any of the soul searching to say, what did we do well, what did we do poorly, and how do we prepare for future pandemics, or more generally, low probability, high consequence events. I think there's always a danger of being the general who's fighting the last war and saying, okay, well, let's get really ready for a respiratory pandemic. And then it turns out to be a solar flare that knocks out the electricity grid, the rise of antimicrobial resistant bacteria, some weird fungus, the growing challenges associated with climate change and storm surges in coastal regions, whatever. So I think the more general lesson we should be taking is not, oh, let's get ready for another, coronavirus, but let's improve our ability to characterize the threats associated with these low probability, high consequence events and figure out what we need to do with respect to preparing for those.
Thank you. I have to say I hadn't thought about solar pulses in a while. So, but I think your point is very well taken overall. And how do we shift philanthropy, but also the whole, all the different actors towards investing in preparation and prevention. Switching to you, John, the Global Fund was set up as a pretty unique, large public-private partnership and invested $4 billion every year, primarily towards HIV, TB, malaria, but more generally making health more equitable for all. And a lot of the funding still comes from the public sector, but your role is about private sector engagement. And really, I was looking at some of your numbers. It seems private philanthropic gifts are increasing quite solidly and significantly. And really that money can be used towards innovation. So how important in your view is it for philanthropy to help at that sort of first step to prove a concept before governments can help scale innovation? John, you're on mute. Oh, thank you.
Never, you think after all this time I'd be able to get off mute quickly. But thanks, Alex, and thanks for having me here with this esteemed panel as well. I mean, I think it's a really central question, that obviously, as Tom just laid out, is probably on people's minds in ways that it's never been before, which is fantastic. I think maybe just to 2 lines on the Global Fund, just to put this in context. The Global Fund, as you said, was designed sort of quite uniquely 20 years ago as a public-private partnership. And it was really designed in the context of recognizing that individuals can't really drive change at scale. That what you need is a collective agenda. You need, health systems across the world are mixed systems. They are public and they are private, and they involve people and communities and civil society. And if you don't engage the full breadth of those sectors in a response, you can't change the context, as we've seen very much in the last 18 months. And the trick, I think, is to make sure when you're looking at those sectors, you're really leveraging the particular skill sets and capabilities, but actually you're also combining them to make sure the sum is much greater than the parts. And that's really been the concept of the Global Fund that has driven major reductions in the biggest disease killers. We've saved something like 38 million lives in the last 28 years through this concept. And so how philanthropy fits in, I think, is really important, to say that the unique capabilities of philanthropy to really drive innovation, to really take sort of risk in pushing new solutions into the hands of people that need them, I think is really fundamentally different to how public money can play. And we, like I think many organizations you would speak to, have the common problem. I think it's the humanitarian dilemma, which is, should we invest in saving one life today, or should we invest in an innovation that will save 2 lives in 5 years' time? And it's one of those impossible dynamics that actually philanthropy allows us to really deal with very powerfully. It allows us to put money into leveraging digital technologies into the hands of frontline health workers, which increases their efficiency by 300–400%. It allows us to change the trajectory of disease. It allows us to deal and support patients more effectively. Investing in those kinds of innovations, investing in supporting the entry into countries of new tools like improved bed nets for malaria, or better diagnostics, it is really central to making sure that not only you're dealing with the problems today, but also you're increasing your effectiveness and efficiency. And that in the Global Fund has been the power of philanthropy. We work with foundations like Rockefeller, the Children's Investment Fund Foundation, who you was mentioned earlier, obviously the Gates Foundation, and many others. Really with this idea of saying, leveraging the different distinctive capabilities of philanthropy to drive change and to create the solutions of the future, allow the Global Fund to progressively get better at what it does, allow the countries to progressively support people more effectively. And so spaces like digital health is one example. Obviously the introduction of new tools, as we've seen with COVID, is another. But I think those are the critical spaces where philanthropy has a huge value proposition to play, and we've seen it very much in the last 20 years.
Wonderful, thank you. And for participants who are watching, please don't hesitate to start putting questions in the Q&A box. I'll be checking it as we go. I'll integrate some of the questions in my questionnaire, but then also at the end we'll have 15 minutes or so left for Q&A. So please start writing some questions. Turning to you, Greg. Like myself, you were based at the Massachusetts Institute of Technology, and your work is with the Abdul Latif Jameel Water and Food Systems Lab that we call JWAFs. And students and faculty are important collaborators in this work. So you focus on climate and food, and those are 2 areas where prevention and preparedness are essential, and I think you would probably agree with me, completely underinvested. And so how does philanthropy support the work you're doing towards innovation in this space, and what more could they do?
Sure. Well, thank you for the opportunity to be here and to be on this great panel. So some of the ways that philanthropy has supported the work of JWAFs has been through things like supporting graduate students, supporting grants like we've actually collaborated with Community Jameel and the MIT Deshpande Center for Technological Innovation for these solutions grants. So they provide funding and facilitated mentorship for scaling up transformative ideas. And so some examples of impacts is we've had spin-out companies such as Via Separations, which is making graphene membrane technology for innovating in the dairy industry. It's in the food system side. Zybus Systems is developing handheld food safety sensors. we also, one of the sponsors is Rabobank, who's the MIT Food and Agribusiness Innovation Prize. It's a business plan competition for students. So that's one way. I think the other way that we're really trying to leverage through the project that I direct, the Alliance for Food and Climate Systems Transformation, is to actually really start to leverage the collective sources of foundations to support research that fills knowledge gaps, that helps drive innovation and drive scaling of important technologies, important concepts that we need to actually bring food systems to greater resilience and greater adaptation. That actually kind of gets ahead of disaster, and the goal is to build systems that are resilient so you can prevent that. I think, any kind of follow-on questions with regard to that, or I'm sure we'll talk more about that after, but it really, there's an opportunity to supporting research, supporting students, and supporting kind of scaling opportunities.
Wonderful, thank you. We'll come back to you in a minute. I have a question for the whole panel, and I think, particularly when we talk about global health and climate change, establishing resilient systems are really critical to weather the shocks caused by disasters. And that has sort of really, all of these issues are interrelated and have real impacts on families and people, because we know that somebody falling sick in a family can cause huge issues and loss of income, productivity, and in addition to potential loss of life, and can return people to poverty. So helping mitigate that and creating resilient systems is of paramount importance. And so a question for all of you, how can philanthropy really help in this space, but also invest in the primary systems rather than creating parallel systems? And I don't know who wants to start, but I'll open it up to whoever wants to start.
I'm happy to have a go first, if that's helpful. I think it's a fantastic question, Alex. I think one of the things we see very often is that the fragmentation of engagements. That there are many innovations, many of them really fantastic innovations. The challenge, and this is true in the private sector too, of course, is really how do you select the ones that really create scale change? How do you create consistency? Because that's what changes people's lives on a big scale basis, on a national scale or regional or even global, as we're obviously talking about ultimately. I think philanthropy has a really cool key role, as I think we've all said, in innovation. I think one of the biggest gap spaces is in the scaling of innovation. This is where in venture capital it's called the valley of death. I think in development it's the same challenge, where we don't see the ability to take the great ideas and really translate them into real life, big scale solutions in organizations. And I think that's one space where philanthropy could really play a huge role in supporting that migration and translation to scale. I think the second thing is, and I would say this obviously, but I think it's about collectivism and partnership. It's really important to engage, again, as people do in the private sector, with the people who do scale and do go to scale. Because they're the people who can guide an innovation into the real world. We've seen even in COVID that the time it takes to develop a vaccine is now shorter than the time it takes to get those vaccines to people. And that speaks to this need to really invest in the spaces that are building the systems and working with the partners to go to scale, so that when you're creating new solutions, they're scale ready. They can be taken to scale effectively. And so I think these spaces for philanthropy are hugely powerful and hugely satisfactory, because this is where the impact happens. innovation is fundamentally powerful, but impact happens when people get a vaccine, when people are diagnosed with a treatment for a disease, or get a treatment, or they're educated in a school. And so I think it's a fundamentally important space for philanthropy too.
Alex, one area that I wanted to call attention to is the importance of making what I would call non-consensus bets. And let me give you one example of that on the public sector side, which is that DARPA around 2013 began investing in this idea of messenger RNA vaccines. So they provided a large investment in Moderna, for example, a number of other researchers and companies working on nucleic acid vaccines. And I was working for President Obama at the time in the White House. And so when the Ebola outbreak occurred, I worked on getting additional funding for that DARPA program. And I can tell you that there was not consensus for this. It was something that we ultimately decided to do, but NIH, FDA, a number of other parts of the federal government were not convinced that this made any sense. And it really took DARPA supporting the development of a phase 1 trial before NIH and NIAID began to warm up to the idea. Similarly, if you look at venture returns, a lot of the most successful investments that venture capitalists make are ones that the partners are deeply divided over. So it's the ones where there's sort of a bimodal response. So a good example would be Airbnb. And obviously, in retrospect, that looks brilliant. But there were a lot of venture capitalists who said, number one, I'm never going to let some stranger stay in my house. And number two, why would I ever want to stay in the house of a stranger? So they just couldn't understand why that would make sense. And so it's these ideas that, turn out to work. But at the beginning, there can be reasonable people can have a disagreement about whether something is a brilliant idea that should definitely be supported, or it's something that is too risky. So I think there's an important role. I totally agree with what John said, which is that developing the technology is necessary but not sufficient. You can have the greatest vaccine in the world, but unless you've got a system for actually vaccinating people, it's not going to do any good. But remember, the conventional wisdom at the beginning of the pandemic was that this could take up to 4 years, and the idea that you could have a system where, without even having the virus, just having the sequence, that you could design a vaccine within 48 hours was not part of the conventional wisdom. And now people are talking about a plan supported by CEPI, where philanthropy played a very important role in getting that going, further reducing the time not only to develop, but to evaluate a vaccine down to 100 days. And that obviously, if we had that capability, that would be genuinely transformational.
Thank you. Yeah, and I think you're building on John's original dilemma, which is, do you save a life today, or do you invest in a solution which John said 2 lives, but it could be 10 lives or 100 lives. But then on top of that, some of the risk, and this is part of the dilemma as well, is you don't know whether it works. It might, in fact, you have to invest. It might save 100 lives, or it might save 0. And that's sort of the dilemma that you're facing. But in a sense, I firmly believe, and I think that the panel is aligning with me, that as philanthropy has the ability to take those risks in a way that perhaps government funding is less able to. And just for the, just as a clarification, Tom, DARPA is the research arm of the US Defense Department, is that correct?
Right. It was created after Sputnik, with the goal of avoiding technological surprise for the United States. It's the agency that was responsible for developing the internet, so that DARPA program managers who work there say, if you don't invent something as important as the internet, then you get a B.
Wonderful, thank you. I've always been fascinated by that department. And then Greg, finally going back to this, either building on the comments of your two fellow speakers, or going back to that question of how do we invest in resilient systems and avoid creating parallel systems?
So I think there's, building off of what Tom and John said, one is I think the opportunity for philanthropy is that they can take risks that private sector and public sector may not be willing to take out of the gates. The other is I think that we're at a really important kind of, I think, an inflection point with philanthropy, where a lot of the different challenges globally are coming together. I think COVID-19 actually showed us the fragility of our food systems, supply chains, right? So where this inflection point puts us is actually as an opportunity for philanthropy to start to build around coordinating, or identifying, really kind of knowing who's doing what where, and knowing how that money, how those resources are being applied, or it provides opportunities to come together and potentially add more resources around a certain topic or certain topic area, start to identify where the gaps are, in a way that I think going it alone as an individual philanthropy organization, you might not be able to do. So I think that's one of the opportunities. And I think that's, kind of philanthropy organizations with good foresight have that. I think we're starting to reach that point where that's the next direction.
Wonderful, wonderful. And I'm also seeing a bit of a dilemma also emerging between the need to coordinate, collaborate, work across sectors, and then also this idea of not always following the consensus, right? And you have to hold those two truths and walk that line, and I think an interesting way.
I don't think they're mutually exclusive either. I think if part of the coordinating, you could say there's a big gap here, and I'm going to take a risk as a philanthropist and actually go out on a limb and try this. And there is that, do I want to take the path with others, or do I want to see this as an opportunity and see if I can take a big risk, see if I can have an impact?
Wonderful. And I wanted to dive a little bit deeper. We're going to move a little bit to the challenges. I mean, we really started talking about this already, but the challenge, why, in a sense, philanthropy, despite the need, hasn't necessarily really invested enough in prevention and preparedness, and that generally there's too many short-term pressures on a whole host of actors, be it election cycles, quarterly returns, the next press release, whatever it is, which means that a lot more dollars are going into the immediate rather than the important and long-term. And I think, in a sense, Greg, building on what you were just saying, there's no bigger paradox in a sense as how that comes about in climate change. And so I think, how do you day to day, when you're speaking to prospective donors or potential collaborators, and particularly non-scientists, how do you convince people to get involved in this work, which may take, which is paramount, but may take decades to really show any impact?
Well, I mean, so that's a good question. In my work in particular, I think food is very personal, right? We all have to eat, and food, our cultures are built around food. So I think it's much easier in my position to kind of tie that back to personal reflection. I also, highlight the fact that we're kind of behind where we need to be with regard to making our food systems more resilient to climate change. And there's an opportunity there to drive positive change, but that, also some of the biggest opportunities require patience. They require a philanthropist or a government or a donor, like a USAID, to say, yes, in this typical 5-year project cycle, being able to say we built that little canal is easier and be able to measurable than to say we started this process where we help move a community towards change that will actually make them more resilient to climate change. That's actually a really big challenge, because humans by nature are pretty impatient. We like to see results fast. But where I think some of the real impacts are is, yes, you can invest to get that next big technological innovation, but most of those take a long time too, right? So think about how long it's taken us to get to where we are with solar. It's having that foresight to say, this is a multi-decadal investment in the case of solar that is starting to pay off. So, part of what I communicate is where the needs are, and the needs are for coordinated systemic change, and that's hard work, but that's where the biggest opportunities are. Did that answer your question?
Yes, and we can have John and others also build on that. So switching to you, John. In a sense, the Global Fund is aiming to harness the best of all the sectors, and both at a global level and at a local level. But I'm sure there's a lot of challenges still, and notably every 3 years you raise pledges to support your work, and that seems pretty short term overall still. But how do you really work to align everyone basically, and what are some of the challenges in that alignment?
Yeah, thank you. Maybe just to build a bit off Greg's response too. I think the construct of around preparedness, we have to be careful to separate it from dealing with the things that are in front of us today. And I think particularly in health that we have many pandemics, particularly in lower middle income countries, which are still killing millions of people every year. And aligning the preparedness around systems that are used, I think, is really critical. That we need to your point about resilient systems for the future, they need to be built off the things that are used and useful today. The same systems that eliminate malaria are the same systems that are identifying COVID surveillance. So I think it's really fundamental that we there are differences around preparedness, obviously, but there's also a central piece around building it integrating into resilient systems that are dealing with the issues today. In terms of this idea of mobilizing all the different sectors, it's difficult, it's complicated. The public, private, and civil society sectors probably disagree on more things than they agree on often. But I think that the power of bringing them together, the power of the alignment, is way greater than the sum of the parts. The way that the Global Fund has been successful in doing it is through a number of things. One is to be really clear about the what. What actually is the outcome that everybody is driving towards, and how do we make sure that collectively we drive with our assets and our resources, whether it's philanthropy or pharmaceutical companies building solutions, or governments funding the solutions. How do we clear about how that alignment works towards solving the critical problem? I think that's central. I think the second thing, and this is always controversial, but to be clear that everybody needs to win. If you want to create sustainable partnerships that are really going to create change on a big scale, they don't tend to last if somebody is losing as an outcome of the conversation. So it's really important that companies make money. It's really important that the impact is driven by the things that companies produce. It's really important that the ethics and morals of how this gets delivered are agreed with the activists and the civil society. And that needs to be negotiated. That needs to be actively worked out in the delivery. And that's really the role that organizations like the Global Fund play, is to negotiate the solution in a way that holds that partnership together, so that there is a common goal, but there's a common set of outcomes that allow people to sustain it. And then the last one is it needs effort to keep it going. 20 years of engagement with cross-sectoral actors, philanthropists and private sector and governments and civil society, requires 20 years of effort to make it work. And that's really important to get to this success. So it's, as I think the Global Fund and many other organizations have shown, it's fundamentally powerful. It allows people to move national agendas. It allows us to move global agendas, which would be very difficult if we didn't have this partnership of people. But it takes some energy and effort to do it, for sure.
Thank you. I have a couple more questions for the panel, and I see some Q&A questions appearing, but please keep them coming because in a few minutes I'm gonna switch to asking the questions from the audience. And so a couple more questions from me first. So Tom, over to you now. So looking, I think, beyond the COVID crisis, Schmidt Futures has been clear that your mission is about talent and empowering talent to work on the hardest problems. And there are a lot of your initiatives. I'm thinking of RISE, I'm thinking of your work on scientific research that takes a multi-decade or certainly very long-term view to things, which is fantastic. So I think, how do you encourage others, other fellow philanthropists, to also take a long-term, multi-decade view?
Yeah, so let me give one example. So we have a program, a fellowship program that recruits young computer scientists who are interested in leveraging their skills to solve important societal challenges, both domestically and globally. So whether it is fighting gerrymandering or reducing prison recidivism, increasing agricultural productivity in East Africa, reducing the word gap between children from rich and poor households. So our hope is that by giving young computer scientists from some of the leading universities in the United States, that we're going to have an impact on the trajectory of their career, and that this is a theme that they're going to come back to over the arc of their career. And so one of the things that we've been doing is explaining to foundations that don't have a focus on science and technology, but care about health or care about energy or care about poverty alleviation, why having some people with technical skills really understand that problem and be in a position to make a contribution to it can really be transformative, given the advances that we're seeing in technologies like cloud computing, data science, and machine learning.
Yeah, wonderful. And good that you mentioned this program with Solve. I believe we actually have a couple of your APMs, which are helping some of our Solver teams around the AI for Good challenge or prize that we've been running. So it's really a fantastic program, and thank you. To close us off for my questions, and then I'll start asking some of the audience Q&A questions. It's going back to something that Tom often talks about, and really the need for philanthropy to invest in moonshots. So I guess starting back with you, Tom, but then broadening out, how do you think about moonshots? What percentage of the portfolio should be dedicated to it? How, going back to this idea of non-consensus, like what's the balance between really taking risks versus scaling things that we think are working?
Yeah. So I think that there's a particular type of agenda setting that, if it's done well, can really serve as a magnet for talent and resources. And the first part of that is to identify a goal, which, if we could achieve it, everyone would kind of universally acknowledge that would be a big deal. But I think that is necessary but not sufficient. I think the other thing is the why now story. So what has changed that leads us to believe that that goal is now within reach, whereas 5 or 10 years ago, it might have been impossible. So, why have some philanthropists recently stepped up their investment in cancer when we've had a war on cancer since 1971? Well, the reason is we can now engineer the white blood cells in your body to destroy tumors. And for some patients and some types of cancer, this is leading to long-lasting remission, as opposed to the 3 to 6 month improvements in survival time. So that, combined with the fact that the cost of sequencing the human genome has declined from $100 million for the first one that we did to now below $1,000, and you begin to see how we might really be in a unique position to move the needle. So that's where I get excited, is not only where we have this ambitious goal, but something has changed about the world, new fundamental scientific insights, usually a combination of new technologies coming together in a novel way, some new business or financial model. And I think that there is a lot of philanthropic capital that is on the sidelines because I think many philanthropists are just sort of overwhelmed by the choices that they have. And I think one thing that would be incredibly useful is to do a better job of curating some of these opportunities, so that if a philanthropist says, I really care about energy and climate, or I care about health, or I care about poverty alleviation, that we can present to that philanthropist a set of choices for areas where we may be on the verge of really transforming our ability to solve a particular problem, in the same way that cancer immunotherapy could transform the way we treat cancer, or mRNA vaccines could further reduce the time required to respond to an emerging infectious disease, or even though we've always said that fusion is the energy technology of the future and always will be, there are actually some ideas that are bubbling up from the research community that may allow fusion to work this time. So what are those types of opportunities that, with some additional investment, could transform our ability to solve some of the toughest challenges that we face?
Yeah, interesting you mentioned fusion. Side note, my father worked in France for many years on fusion. But I think one of the questions in that I think is interesting as well is, you're saying, have a better visibility and when something is on the cusp of, then have philanthropists really invest in that. But I guess it's building on, and you mentioned, for example, DARPA for mRNA. There's still someone somewhere putting the first dollars, and we're the first movers on something, something that, there was no, this is on the cusp of working. It was more, this is we don't know how long it's going to take to solve this. And I guess you want both, right? You want both the people who are ready to put in that first check, even though it might take 10, 20 years, or it might never work. And then once that shows promise, then you want the other people to crowd in, and that's a market that's not as transparent as it could be or should be.
Absolutely.
And I just want to quickly build off of that comment and what Tom said about that is, part of, Tom talked about, curating opportunities. I think part of that process is that some philanthropy organizations may be comfortable in, identifying those opportunities for those moonshots, for that 20, 30-year investment, but others may be more comfortable being able to kind of have an impact in an area where we're ready to go. And so I think this curating and this being able to present opportunities and also being able to indicate how they connect to other related parts is really one of the things that's needed, and that I think could help improve impact.
And Alex, if I may, because you've started a fascinating conversation, but I think to Tom's point about these change spaces, I think one of them that we've all seen in the last sort of 15 months is information, is data, and particularly data around disease, obviously. And you know, one of the things that, you know, I used to work in the private sector, I worked in banking, is, you know, you recognize that in banking, you can get a daily flash report which tells you your global performance pretty much, you know, 90% accuracy around the world. You're working in a global health organization spending $4 billion a year, and you're looking at sort of 12, you know, months of delay on information. And what COVID has demonstrated to us, and it's demonstrated us all the way down to ministries of health in countries, is that 24-hour data or 48-hour data on disease surveillance is a practical reality. There is no reason why that can't happen. And so that it's a partnership we have with Rockefeller at the moment, which is looking at how do we transform information systems at the last mile, not at the front of the information system, but at the furthest reach of the information system, because that's a fundamental possibility. The technology exists. It's not a capability issue. It's a willingness issue and a financing issue, and finding the right model. But I think these moonshot ideas to say, you know, we should expect 24, 48-hour, you know, real-time information on health in countries, and patients having that information, I think is one example that where, you know, philanthropy could really drive a fundamental change. And of course, for the next pandemic, and even for this one, that puts us much more in this sort of resilient system place where we actually can understand the health. You know, before we even get to the point of needing a vaccine, actually we can deal with these issues more effectively, you know, before there are outbreaks, before we lose control of these issues. So I think, you know, those are spaces where I think, you know, this confluence of technology and recognition of the possibility are really powerful for us to look at.
Wonderful. Yes. I want to switch to questions for the audience in the last, we're now 8 minutes, 7 minutes, sorry. So starting with a question from, and I apologize for mispronouncing your name, Nushti Chris Kagabe. How can social entrepreneurs have more access and contribute to philanthropic efforts? And I think this builds on this issue of maybe transparency and understanding the market. And so if you're a social entrepreneur, and I'm not sure where Nushti is based, but how can they understand where there is funding from philanthropists for issues that they're working on? Don't know if anyone wants to take that question.
I'll take a crack at it. So I think that one challenge associated with philanthropy is that if you've met one philanthropist, you've met one philanthropist. And there's just a fair amount of heterogeneity in the issues that they work on, their tolerance for risk, their theory of change, and their geographic focus. And so, unfortunately, there's not really a substitute for, over time, getting to know the philanthropists and funders in the areas that you're interested in, and, you know, figuring out how they make decisions. So you've got, for example, some philanthropists who will do plenty of open calls, and you have others that don't respond to, you know, sort of over the transom requests. So unfortunately, it's not a very efficient market, because there is no equivalent of a you know, risk-adjusted return that serves as the universal lingua franca that exists in the with respect to commercial investments.
Yes, thank you. Yeah, and I think some of what Solver is trying to do is trying to create a bit more transparency, certainly for innovation and one specific part of that that spectrum. Question from Now Valentino, and again, apologies for mispronouncing anyone's name. For future forward innovation initiatives, I was going to write another question, apologies. I was going to read the first question. Why do you think there aren't more funders in the preparedness and prevention space? That's the question I thought was interesting.
I can take a crack at that. I just don't think it gets that much attention. I think it's you know, a disaster hits and responding to a disaster. It's the way in which our media cycle works, the way in which our narratives work is, you know, all of a sudden everyone shifts and focuses on that disaster or focuses on that challenge. So I think so part of it's the way our media infrastructure works. Part of it, I think, is probably the way the human brain works. And part of it is that, you know, preparedness takes time and is something that happens behind the scenes. And so it's harder to highlight. It's harder to highlight that work until it's needed. And if it's done right, then you don't have a massive disaster to respond to. So it's one of those things that, you know, it's less obvious.
You can't prove, I mean, you can't actually measure some of it in the sense that you can't, the counterfactual of the disaster didn't happen is not, you can't actually measure it in that sense. So yeah. Maybe, I don't know, between countries or something, but that's so difficult. John, did you want to add anything? Else I'll ask one last question from the audience.
Yeah, no, just very quickly. I mean, you know, I think it's this concept, isn't it? We're all very comfortable with insuring our house because we recognize that, you know, the bad things and big things can happen. But we haven't really adjusted to this sense that, and again, you know, the last 18 months should really tell us this. But how do you insure yourself against a future, which, you know, again, to Tom's point, is, you know, is very complex. What's the next disaster going to be that befalls us all? And I think it comes back to this thing around creating these mechanisms that allow you to, a bit like an insurance company, to pool your agenda so that you can participate in the insurance for the world around the next pandemic. And I think that's the message we have to get across to people, is that's crucially important, and we will not be insured if we don't buy our health insurance in the future. And I think that's a shift that hopefully this pandemic will bring people to. I think in climate change, it's the same. You know, we have to move people into that space.
Alex, I think one way to address this is, I think philanthropy can help identify and, you know, if not fix by themselves, at least to develop an agenda for fixing really high consequence market failures. So the UN has estimated that if we do nothing, the deaths associated with antimicrobial resistance are going to rise to 10 million per year by 2050. Is the private sector left to its own devices going to solve this problem? No. And the reason is that the pharma drug model is based on number of pills sold times price per pill. And antibiotics, you take a short course for a week and then you are cured. So if you're a pharma executive, would you rather invest in something for chronic disease where once someone takes a statin, they're on it for the rest of their life, or something where you may develop it and public health authorities may say, well, let's keep it in reserve as a second line of defense. So the current revenue model for pharma is not conducive to them investing in new antibiotics. The experts are telling us we are in the middle of a long, slow motion car crash in which, if we don't do something, we will be living in a pre-penicillin world in which an increasing number of surgeries are just too risky to do. And experts, if we're willing to listen to the experts, they're saying the private sector is not going to solve this problem. Left to their own devices, we have to come up with a new model for engaging pharma companies in the same way that Gavi used advanced market commitments to get vaccine manufacturers to develop vaccines for diseases of the poor. Left to their own devices, drug companies are not going to work on vaccines for people who are living on $2 a day. So identifying these areas of prevention where it's clear that the private sector will not fix the problem by itself, and then trying to figure out what is the right public-private partnership, I think are incredibly high leverage areas for philanthropy.
Thank you. And I think that in a sense, this agenda setting, we didn't talk too much about it, but you referred it, this agenda setting and problem identification, in a sense, is key in at the early stages to actually then go and solve the right problem. But we're at time. So I want to thank all our esteemed panelists for taking the time today to, on multiple time zones to be with you all. I want to thank Rania, Lamia, and Sumaya at the Pearl Initiative for all their work. And I don't know, Rania, if there's any more housekeeping I need to do, else I will bid everybody farewell.
Thank you really to our esteemed moderator, Alex, and our panelists, Tom, John, and Greg. It was really such an inspiring, passionate, and thought-provoking conversation. I know there are a few questions that we couldn't get to, but we will follow up with our participants and encourage you to reach out to us via our website, social media channels, or email for upcoming sessions as well, or to go deeper into any of these topics that we discussed today. But thank you once again for all of your time and efforts, and please stay safe and healthy.
Thank you. Bye, everyone. Thank you so much.